important. At the base of the uterus is the cervix. Put your finger there and touch that. Feels like a tip of your nose, doesn't it? Mm-hmm. The most important thing we're talking about today is this structure right here. This is the vagina. This is the back wall, and this is the front wall. Can you all see that? Now, if you don't mind, touch that and just describe it to everybody. Thin, thick.
It's in between thin and thick, sort of like the fat on a chicken.
Like the fat you take off a chicken. Mm-hmm. Oh, it's just but the food here. All right. Mm-hmm. So don't let it go there now.
Okay.
All right. Now here's the thing. You know, it's thinned out here because this is from an older woman.
Okay.
And if you look at that opening there, you can see that sometimes when it's too thin, it can get fragile. And that's one of the reasons that we have problems as we get older, that the vagina actually starts to look differently, and it ages as you go into our 40s, and it thins out. And this structure that we're talking about here is one that, of course, women have but don't even think about. So you can put your gloves down.
Thank you.
Dr. Asher, what do you think causes thinning of the vaginal wall after the age of 40?
Well, the key hormone that we're talking about is estrogen. And when estrogen in our blood and in our body drops, it makes the skin or tissue in this area very, very, very delicate. So if you think about a present wrapped in tissue paper, that tissue paper becomes almost brittle. You can't even get to the gift. And that's what happens.
Well, Harriet, welcome to the vaginal walls. Right? This is your vaginal wall in your 20s and 30s. Now, what I'd like you to do is to take this hammer.
Okay.
And I want you to try to put a hole in the vaginal wall in your 30s. Go ahead again. Go ahead. All right. No. That was a pretty good hack, right?
Yeah.
You can't get through there. This wall is very resilient. It should be resilient because that's how resilient the vaginal wall is in the 20s and 30s. It's bathed in all the right hormones. It's getting all the right stuff that it needs in order to grow, become robust, and therefore it's much more flexible and able to cope with sex. Now let's walk over to the vaginal wall in your 40s. Now, I want you to give us a hit, but remember, I expect it to be a little bit thinner. Go ahead.
Okay.
Ooh. Go ahead, give it one more. See?
Oh.
Yeah. So that was pretty aggressive.
You said to give it a good hit, so I'll give it a good hit.
I did another hit. So it's getting a little thinner, it's less resilient, and it's still not going to fracture at moment's notice, but it's a bit of a concern that it's gotten thinner. Now let's walk over and look at your vaginal wall in your 50s and beyond.
I don't want to know this because I'm 57.
You are?
Yeah.
All right, well then hit it gently.
Okay. Oh! Oh!
Yeah. But this is unfortunately what happens. When you get a tear like that, you end up with a defect that's painful, it's irritating, and because of the fragility of it, you have pain during sex.
Okay.
Does this make sense?
Yes, it does.
All right, Harry, thank you very much.
Thank you, Dr. Oz.
So, Dr. Ashton, how can women at home determine, without having this model in front of them, whether they have a fragile mucosa of their vagina?
Well, something really easy that people can do at home: get a mirror, get familiar with the external opening of your anatomy, and this is an area where people actually want to strive for an average color. We're not talking about their skin color, so it doesn't matter what color a woman's skin is. It matters the color of the tissue and the opening of the vagina. And we don't want it too pale. We don't want it too bright red. We want something really in the middle, like a deep pink. That signifies healthy vaginal tissue.
This is what Dr. Ashton is talking about. If you look at these two color wheels, you see the healthy vaginal wall. Again, this is on the inside. If you're looking down in your vaginal area, it should be that robust color that we talk about here. And again, it doesn't matter what your outside skin color is. It should still have that sort of pinkish color to it. If it's pale, as you see on the right side, that's a sign that you might have a thinned out vaginal mucosa. And these are the kinds of problems that we like to treat as physicians to make sure you're not having pain during sex. Dr. Goldstein, you run a clinic that specializes in women who are having pain during intercourse. What do you recommend for women who have thinning of their vaginal walls?
Well, the main problem is they lack estrogen, so we need to replace the estrogen. So we can do this with several different products. This is called Vagifem, and this is a little estrogen tablet that comes on like a Pez-like dispenser, and women just shoot it into their vaginas. Okay. This is a...
Don't touch that, please. There's a scramble here in the pit. Melee ensues.
This is a vaginal estrogen ring. It's a rubber or silicone type of ring, and it's very soft, and it goes in a woman's vagina, and it stays there for 3 months, and it slowly releases estrogen. And there are other sprays and creams, although they're a little more messy, that women can use to replace the estrogen.
Dr. Hutchinson, what do you recommend?
Well, for women who don't want to use estrogen or can't use estrogen, I find a little bit of olive oil.
Olive oil.
just not extra virgin olive oil.
Oh my goodness.
And you just want to use a little bit, and you actually massage it into the vaginal wall, and it works really well. And sometimes women don't feel comfortable doing it themselves, and you can get your partner to do it for you.
I like that idea.
Yeah.
Don't you like that?
It's great foreplay.
Exactly, I like that.
Yeah.
All right, the second way your vagina ages after 40 is atrophy at the vaginal opening. Now, atrophy is when the mucosa shrinks down. It sort of wastes away. So what I'm going to do is to show you exactly what I'm talking about. I need a little bit of help from the audience. So is Michelle here? There's Michelle. Welcome,
Hi.
Michelle.
Good to see you.
So I've got a little model here for you. Looks like a bowling alley, doesn't it?
Yeah.
Yeah, for good reason. So here's what we're talking about. Imagine this bowling ball is the penis.
Okay.
It's different shape, but just give me a hand on this.
Okay.
The opening of the bowling alley is the vaginal opening.
Okay.
Okay. The little guards here, the gutter guards, these represent the vaginal walls, these bumpers. And those pins at the end, that's the orgasm.
Okay.
Okay. So your goal is to get the penis to the bowling pins, because that way you've got an orgasm. All right?
No pressure.
No
right?
pressure.
No
All right.
pressure.
Well, you know, I've got these little bumpers here to help you out.
Okay.
All right. Let's see how you strike.
Okay.
Throw a strike now. Oh! Very good. Very good. Now, if we think about this, as a woman ages, you can hold the penis again.
Okay,
all right?
thank you.
You've got the vaginal wall here, and what ends up happening is the mucosa here begins to atrophy, and as it atrophies, it begins to narrow. And you have the same problem at the opening of the vagina as well. All right? So go ahead and try to throw a strike now.
Okay.
Yeah. It gets stuck and has no power. It doesn't get where it needs to be.
Right.
Even more importantly, this can close almost all the way. So you can't even begin to have intercourse because it's so painful. Do you ever feel like this is happening with you?
Yeah, there are times where it's gotten very uncomfortable. Oh, you know, a lot of things changed in my body when I turned 40, but that's definitely one of them.
Uncomfortable, like you don't want to do it anymore.
Well, it gets a little painful sometimes, you know.
Yeah.
So.
Michelle, thank you very much.
Okay.
All right. So Dr. Asher, how common is this, and how do you tell if you're having this problem?
Well, we don't know how common it is because most women don't feel comfortable talking to their doctor about it, and that's something that both the doctor and the patient really need to work on together. But one clue to this type of situation could be if you're having pain, is it on initial penetration or is it on deep penetration? And that's very important. Just giving your doctor that information can be enough to really let him or her start to help you.
Again, it's a way of giving us advice about what's happening in your lives, which teaches us also, because if we don't know, we can't treat it, and we often don't hear this from many of our patients. Now, you all agree that there's one way to combat the atrophy of the vaginal mucosa, right? What's the best way to do this? Who wants to go first? Dr. Hutchison?
Well, one of the tools that I use and which women can get online, you need to discuss it with your doctor as well, is something called a vaginal dilator. And they come in different sizes, different widths. And you start with a small one and you slowly progress up until the largest one. So you're doing this every day for about 5 minutes with a lubricant. And what this does is it stretches out that tissue that's dry and thin and has possibly shrunk just a little bit to make sex more comfortable.
And Jen, you had one more point?
Use it or lose it, Mehmet. This is an area that's like your bicep. What happens if you don't use your bicep? It becomes saggy, out of shape. The whole pelvic floor is the same. So you actually want to have more sex so that you can have more sex.
All right. Well, up next, the gynecologists are revealing their roadmap to an orgasm to do just what Jen was describing. Stay with us.
Coming up, how well do you know your anatomy?
Not that great.
The roadmap that you and your partner need to know.
There are 3 areas that hold a key to an orgasm.
The Gynecologist Guide to Sex After 40 continues.
This is absolutely essential anatomy for everyone to understand if you want to have an orgasm. I assume you're interested in that.
Definitely.
Improve your sex life. Plus,
Antihistamines, birth control pills, and antidepressants.
medications that could have negative effects when it comes to intercourse. Find out why next. And tomorrow, can you stop Alzheimer's before it strikes?
You actually have a ton more control over it than you think.
The breakthrough discovery that could diagnose you years in advance. Plus 5 brain-boosting superfoods. That's coming up tomorrow.
to the Gynecologist Guide to Sex After 40, and they're about to reveal the roadmap to an orgasm. You won't want to miss this, but you want to send your kids out of the room because it's going to be a pretty frank discussion. So, Dr. Ashton, you've seen thousands of patients with a variety of different issues related especially to sexual problems. How much do they really know about their anatomy?
Unfortunately, not a lot. I would say that 80 to 90% of women don't know the proper anatomy terms for their own body. They might be able to feel something in the shower when they're cleaning themselves, but they might be embarrassed. They might never have been taught this information. It would be like if you had a problem with your nose and you went to your doctor and said, I'm having a problem with this. It's hard to get help for it if you don't know the terms.
So I wasn't sure if this was right or not, so we're going to do a little game here. I'm going to ask a volunteer to come up. Any volunteers out there? Who wants to be? Come on up. How are you?
Fine.
What's your name?
Marilyn?
Marilyn. All right. How well do you think you know the anatomy?
Not that great.
Not that great? You want to give it a little shot at it?
You seem like I'm going to learn something today, huh?
You think you'll learn? Okay. So let's just get started with the basics. Just identify, if you can, where the vulva is on this. And audience, you can give her a hand if you want. Give her, a little advice. Vulva. Where's the vulva there?
You want me to?
Yeah. Just point to the vulva.
Top, middle?
Top, middle. All right, you know what? I'll help you out. The whole thing is the vulva.
Get out of here.
This is a map of the vulva. Now,
okay.
Dr. Goldstein, explain the difference between the vagina and the vulva for everybody. Pay attention now.
Okay.
So the vulva is the external genitalia, so all the different parts. The vagina is the tunnel, the birth canal, and it's inside and it's very important, but often not as sensitive as the vulva. So the vulva is the entrance, the key to arousal.
Okay, so there are 3 areas on the vulva that hold a key to an orgasm. All right? They are the clitoris, the vestibule, and the labia minora. Okay? So all you need to do is take these 3 labels and put them where you think each of these areas are. All right? The clitoris.
Okay.
Yeah.
I know that's further up.
That's a good start.
So, the top.
Good. All right. Good. Okay. Where do you put the vestibule? The labia minora. That's an easy one. Labia minora. Go ahead, but that's fine. Believe me, I guarantee you do as well as everybody else is. Okay, put the vestibule any old place.
Vestibule?
Have you ever heard of it before?
No.
All right, I'll take this one. I'll help you out. Now, we're going to start off talking about the easy stuff. We're going to move it to a little more complicated.
Okay.
But this is absolutely essential anatomy for everyone to understand if you want to have an orgasm. I assume you're interested in that.
Definitely.
Okay.
Yes.
All right. So let's first start off to orient everybody. This is the clitoris. All right.
Oh.
Right there. That is the clitoris. Dr. Ashton.
Didn't hit the spot, huh?
No, do not get the spot. Help everyone understand why the clitoris is so important for sex.
Well, most women have heard of it, but they don't understand, and they may not have heard, that the equivalent structure in men to the clitoris is the penis. So when you think about sex, most people, men and women, just think of the opening. They get tunnel vision, pardon the pun, and by doing that, you miss most, if not a majority, of the action, which really occurs with the nerve endings that are located in the clitoris. They have thousands of nerve endings, as much, if not a little more, than the penis. Sorry, Mehmet. And so it really needs to be given particular attention. You also need to remember that while it needs to be stimulated, too much pressure can actually cause pain. So you really have to approach it in just the right fashion.
Yeah, so you thought you knew about the clitoris, but now you know a lot more.
Yes, I do.
Okay. All right. Now, that was vulva area number 1. Vulva area number 2 is the labia minora. The labia minora is this area right here. Okay, that area right there. So I'll put this little label there. Dr. Goldstein, explain why this is such an important area for women who want to have an orgasm during sex.
Well, the labia minora have lots of nerve endings, so gentle stimulation of those nerve endings will cause increased blood flow to the area, which will cause arousal and then lubrication.
So Dr. Hutchinson, how does the labia minora help with sex?
Yeah. Well, it's very interesting. It's a part of our genitals that women often ignore. And they come in different sizes. They can be very small, they can be very long and fluffy, and they're extremely sensitive. And in fact, for some women, the labia minora is more sensitive than the clitoris. And the labia minora come up underneath the clitoris to this little peak where they touch, and that area is extremely sensitive as well. We call that the frenulum. So if you don't know that it's there, you don't know what to do with it, and therefore you don't have an orgasm.
Right. And the final vulva area, we're going to talk about the third point is the vestibule, which is this red area here, the vestibule. Now, you haven't heard about that, but Dr. Goldstein, tell everyone why that's absolutely essential for people to know about.
Well, the vestibule means entrance to the vagina. So what's so important about this is, first of all, if you are having pain, about 90% of people who have pain in the vestibule. So knowing where it is can help you show your doctor, and they can help them figure out why you're having pain. But it's also important because the glands open into the vestibule. So that's where you get most of your lubrication during intercourse, is glands that open into the vestibule.
And Jen, how do medications affect that whole process of lubrication in the vestibule?
Exactly, and that's often the silent villain in this picture, if you will. So very common medications, antihistamines, birth control pills, some antidepressants can all contribute to vaginal dryness. So you never want to stop that medication before talking to your doctor. But if you're on one and you think you're having problems in the vestibule or with dryness, talk to your doctor. There are plenty of varieties. We've heard about some great ones. This is one that a lot of women like. It's called Replens. It's a combination of palm oil, mineral oil. If you don't want to spend money for that, saliva works really well, and it doesn't cost you anything.
Well stated, Dr. Ashton. You know, if I can make one other sort of overall arching point, if a medication says a dry mouth as a side effect, it'll also dry it up in here. That's one way for you to remember if this might be a side effect of one of the medications that you're on. Now that completes our roadmap. I want you to remember that the better you know your body, the better you have a chance of being fulfilled in your sex life. Marilyn, thank you very much.
Thank you, Dr.
I want to thank Dr. Ashton, Dr. Hutchinson, Dr. Goldstein. Well done. We'll be right back.
Up next,
I have a hard time getting shoes.
embarrassing and painful bunions.
I'm giving you the tools you need to prevent them.
Are the shoes you're wearing making them worse?
Guilty as charged.
I've got 4 bunion busters here.
What you should be wearing,
Who thinks she's right?
and solutions you can try today.
Have you ever seen these things?
No.
That's coming up.